The success rate of quitting smoking when people try to go just cold turkey, just quit with no assistance whatsoever, they might tell their family and friends, hey, I'm quitting, that's it, is exceedingly low. It's 5%. And of the 5% that succeed in quitting, a full 65% of them relapse within a year. So that's a very depressing picture. But it's not to say that people cannot quit. In fact, they can. There are a couple of methods that have been shown to help people quit. Some are behavioral and some are pharmacologic. I just want to touch on the behavioral ones first, because it turns out that there's a quite powerful method for quitting nicotine ingestion by way of cigarette smoking, which also carries over to vaping. This is beautiful work that's been done by my colleague at Stanford, and his name is Dr. David Spiegel. He is a world expert, if not the world expert, in the clinical applications of hypnosis. Clinical hypnosis is where the person, the patient, actually directs their own brain changes toward a specific emotional or behavioral goal. Those studies have shown that using a specific form of hypnosis, people can achieve complete and total cessation of cigarette smoking, and there's no reason to believe this doesn't also carry over to vaping, through one single hypnosis session. The success rate with this particular hypnosis, developed at Stanford School of Medicine by Dr. David Spiegel, is 23% of people who do this hypnosis one time succeed in quitting smoking. You can access this hypnosis. There's a wonderful app that was developed by Dr. David Spiegel and others. It's called Reveri, R-E-V-E-R-I. There are hypnosis scripts within the app for enhancing sleep, for improving ability to fall asleep if you wake up in the middle of the night. There's also a function in the Reveri app for smoking cessation, which exactly parallels the sort of in-laboratory and in-clinic approaches that Dr. Spiegel would use were you to show up at his clinic or in his laboratory. Now, of course, there are other methods that people have used to successfully quit smoking or vaping or other forms of nicotine delivery. There are a couple pharmacologic approaches. One of the main ones that's received a lot of attention in recent years is bupropion, sometimes referred to by its commercial name Wellbutrin. Now, bupropion is a compound that increases the release of dopamine and, to a lesser extent, epinephrine and some other neurochemicals as well. It's used for the treatment of depression and for smoking cessation. But I'm going to give you a little bit of the contour of what's typically done in terms of bupropion administration to help people get relief from some of the withdrawal symptoms of trying to quit smoking or vaping or other forms of nicotine ingestion. Typically, bupropion is taken in 300 milligram per day doses divided into two dosages of 150 milligrams each, or sometimes there's a slow release formula. The dosages will vary from person to person. For people that can take it safely, and again, this is a prescription drug, a board-certified psychiatrist or other physician is going to have to prescribe it for you if it's appropriate for you, and it moves that number of 5% success rate to about what one sees with the clinical hypnosis, to about 20% of people will successfully overcome their nicotine, or I should say their smoking or vaping addiction. A very common approach for people to try and quit smoking or vaping is to use nicotine itself to try and prevent people from seeking nicotine through a cigarette or a vape pen. What I mean by that is people using a nicotine patch or nicotine gum or other nicotine delivery device that is not cigarettes and not vaping in order to maintain levels of nicotine in their bloodstream, which of course means maintain levels of nicotine in their brain and body to the same extent that they would if they were smoking or vaping, maybe even gradually taking down the total amount of nicotine in their brain and body by reducing the number or size of nicotine gum pieces that they ingest each day. So what do we know about smoking cessation using nicotine itself? Is the patch best? Is nicotine gum best? Turns out that a combination of approaches is best. So somewhat surprising, but it was very clear from the literature that I was able to find that using nicotine patches for some period of time and then switching to a gum and then perhaps switching to a nasal spray, that's going to be the most effective. Then the question is how long to continue each of those and whether or not to overlap them. It seems as if doing one for about a week and then switching to another for about a week and then switching to another is one rational and reasonable approach that many people have used successfully. Transdermal patches provide a fairly steady state dopamine release across the day, and oftentimes people are wearing them at night as well. This is relevant because if people are ingesting nicotine by way of smoking and vaping. So people wake up in the morning, and because the half-life of nicotine from smoking or vaping is very short, anywhere from 1 to 2 hours, they're essentially in a state of withdrawal at the point where they wake up in the morning. How can I say that? Well, remember, withdrawal sets in about 4 hours after the last ingestion of nicotine by cigarette or by inhalation from the vape pen. So people are waking up in nicotine withdrawal and then immediately going into the behavior of ingesting nicotine, or very soon after waking for most people. So nicotine patch is going to be very effective for a week or so. Again, talk to your physician about the best approach for this, but then switching to a nasal spray or switching to nicotine gum for about a week, which is going to change the kinetics of that nicotine absorption into the bloodstream and change the release of dopamine and other neurochemicals within the brain. That's going to keep the system intentionally off balance so that it never comes to expect one single pattern or amplitude of dopamine release. And that is a very powerful way for a, let's just call it a quitting method to work, because as I've always said, the most powerful schedule of dopamine is going to be this random intermittent reward. By keeping the total amounts of dopamine variable around the clock, and by changing the amount of dopamine that's released, it seems to help people behaviorally and psychologically, because they don't come to expect having a particular amount of dopamine in their brain and blood at any given time.